In terms of if there were to be future lockdowns or public health restrictions or social measures of this kind, I think the sort of key message and the most important one is that schools should be the last to close and first to open, and educational settings, because they really do provide a very important role, not just only academically, but I think in terms of support and protection of our most vulnerable children and young people. And for times when closures are necessary, we should think very carefully about implementing small group care with trained and trusted adults, and particularly working very closely with vulnerable families. I would also advise that families and educators try to encourage a sense of routine and social connection in ways that are possible. They might not be perfect, but having some systems in place can be really valuable in terms of helping young people get into those positive cycles. However, I also think there are insights from this research which are important regardless of whether we are experiencing a pandemic or social restrictions or otherwise. And I think that is just surrounding the sheer variability of experience. We've said it a lot, but in terms of inequalities, access to resources, help seeking, support available, I think it's really important to just reiterate the point that children and young people in this country have very different day-to-day experiences and very different levels of access to support. Arguably, lots of these things were exacerbated by the pandemic, but they weren't created by it, and they certainly haven't gone away because these restrictions have lifted. In fact, if you reflect on our current socioeconomic climate, arguably they've likely gotten worse. So our study revealed huge differences in those ways that people were able to live their lives and the resources they have access to. So I know it's not novel, but I think it is really important to highlight that more work is needed in this area and greater intervention.